welcome back again to my channel. So this is Nurse Annie again, and to those of you who are new here, welcome and thank you for tuning in. So this channel is actually all about nursing, my nursing adventures of course, my American dream and everything in between. So if you want to be inspired, motivated, or just even be entertained, then don't forget to hit that subscribe button and let's connect. So this video is the 5th episode of the series, The Most Common Medical Surgical Cases that we have. But again, as a disclaimer, what I will be sharing with you on this series are just our own admissions on our own medical surgical floor. So it doesn't mean that all cases that we admit are actually admitted on a medical surgical floor, because I repeat, as I've said on my previous videos, not all med-surg unit admits the same. As I've said, there are hospitals who has subspecialty units as well. So what I will be sharing with you, as I've said, is only our admissions on our own medical surgical floor. So today I will be sharing with you all about our pneumonia admissions. And I mean pneumonia in its general sense. Either it is pneumonia due to infectious organism, or community-acquired pneumonia, or hospital-acquired pneumonia, or multifocal pneumonia, or any other pneumonia there are, except of course COVID pneumonia, because I've already discussed that in the first episode of this series. So today I will be discussing all about pneumonia. Okay, so these patients with pneumonia usually presents to the emergency room with complaints of worsening or increasing chest pain or shortness of breath. Some patients also presents to the emergency room with complaints of increasing fatigue, which might have been going on for days or even longer. Sometimes these patients reports associated signs and symptoms like productive or non-productive cough, loss of appetite, chills, fever, diarrhea, or even extreme fatigue, as I've said, which initially would be thought as COVID, isn't it? But of course, they will be tested negative for such if it's not COVID pneumonia. So naturally, in emergency department, lab tests, diagnostics, initial treatments will be given and done. Lab works would probably show leukocytosis or high WBCs, and sometimes it also shows mild acute kidney injury. However, cardiac enzymes and CBCs are probably mostly unremarkable. And of course, chest x-ray and CT scan of the chest would definitely show pneumonia, and sometimes ABGs would show hypoxia as well, which of course necessitates the patient to be on oxygen therapy. And apart from that, blood cultures will be drawn, and sometimes ultrasound of the lower extremities will be ordered just to rule out any DVTs and such. Additionally, in emergency department, these patients would probably be started on broad spectrum antibiotic, of course, until the blood CS results will be available. Fluid resuscitation will be given as necessary. Of course, breathing treatments, steroids, and any other treatments as indicated would be given. Once the patient is stabilized in emergency department, of course, they will be admitted on our medical surgical floor. And of course, if the patient would be in med-surg unit, you would notice that the orders would include, of course, continue the antibiotics of the patient, which are usually intravenous, continuous IV fluids, but of course, that depends if the patient is congested or not, isn't it? And of course, breathing treatments or oxygen as needed, which can be titrated as necessary, which of course the artist would be consulted to manage those breathing treatments and those respiratory issues for the patient. And of course, cough suppressants like Mucinex, just to alleviate the patient's cough or allows them to rest. And of course, some DVT prophylaxis again, like Lovenox, and of course steroids, not to forget that. And of course, some supportive care or treatments like analgesics, antipyretics, those sorts of things. And so we'll go to the nursing intervention we can do for these pneumonia patients. And of course, first on the list would be assessment of vital signs. Of course, these vital signs will assist you to create an accurate plan of care for the patient, isn't it? And of course, it will also evaluate the effectiveness of your treatment that you have been given to the patient. And second is monitor patient's oxygenation. As I've said earlier, there would always be an RT consult for this patient because they would be the one to give the breathing treatments, Initially, they would be the one to educate the patient on how to use the incentive spirometer. But of course, as a nurse, you still have to monitor these patients for all those respiratory problems, isn't it? You have to encourage them to cough up their phlegm and of course suction them if they cannot manage their own secretions. And of course, you have to encourage them and reiterate the use of incentive spirometer. This is actually very important for these patients with respiratory problems. And of course, making sure that antibiotics are administered or increase oral fluids if it's not contraindicated for these patients, as I've said. And of course, don't ever forget to give these patients their antipyretics or any pain medications if they need it. And any nursing intervention you can do to promote comfort and alleviate their abnormal vital signs. And of course, not to forget head elevation, which helps improve the lung expansion of these patients. That will enable them to breathe better or breathe more effectively, isn't it? And upon discharge as a nurse, we also have the responsibility to educate these patients what they can do at home. We can educate them to take plenty of rest, drink lots of fluids, of course, take their medications as prescribed by the doctor, deep coughing and breathing exercises, of course, hand hygiene, staying active, of course, and any other education we can tell them once they will be for discharge, isn't it? Okay, so there you go, guys, with my video for today. And again, I hope you have learned a thing or two on this video. And if you did, please don't forget to hit that like and share button. And of course, to those of you who haven't yet, please do hit that subscribe button and connect with us. Thank you once again, friends, and see you again on my next video. Bye-bye.